Opioid overdose is a major cause of harm and death in Australia. It is the most common drug class identified in toxicology for drug-induced deaths, accounting for over 60% of drug-induced deaths in Australia in 2020. However, opioid overdose is preventable. Naloxone is a life-saving medicine used to reverse opioid overdose or intoxication by blocking the effects of opioids. In community settings, it can be easily administered via a pre-filled syringe for injection or an intranasal spray. As the most accessible health professionals in Australia, pharmacists have a critical role to save lives through the provision of take-home naloxone. Naloxone is listed as an essential medicine by the World Health Organization. All pharmacies should be stocking it. Some pharmacists might assume that there must be no demand for take-home naloxone because stock kept in their pharmacy has gone out of date. However, pharmacists need to proactively offer and find opportunities to provide naloxone to people who need it. This should be part of your daily practice. Naloxone should be offered to all people who are prescribed opioids for chronic pain, especially if they take other sedatives and have comorbidities, a part of your opioid treatment program or needle and syringe program. Use non-prescription opioids like heroin, counterfeit pharmaceuticals, or use any non-prescription drugs including stimulants like cocaine and MDMA and ketamine. Are hosting or attending a party where drugs may be present? Are family, friends, and carers of people who use non-prescription drugs or are prescribed opioids? Or are first aid trained workers who may interact with people at risk of opioid overdose in the course of their work? Naloxone is safe. Even if it is given to someone who has not taken opioids, it will not cause harm. For this reason, there is more potential harm in not supplying take-home naloxone. Similar to an EpiPen for anaphylaxis, naloxone saves lives. It is our job as pharmacists to ensure people have naloxone with them when they need it. Providing take-home naloxone is easy. Register for the funded Take-Home Naloxone program via the PPA portal. You can provide it for free and without a prescription to people at risk of opioid overdose. Pharmacies are reimbursed for the supply of take-home naloxone. This reimbursement includes the cost of the naloxone product and a dispensing fee. Let your community know that your pharmacy has naloxone in stock. We encourage you to speak to your local prescribers about the value of take-home naloxone. If you have previously registered for the take-home naloxone program but are not actively providing take-home naloxone, please do so and don't miss the opportunity to save a life.